ABN-401 has of course a MET inhibitor. So as we know, actually MET is a very important molecule. We know the EGFR, KRAS, and actually MET is a very well-known molecule to promote cancer progression and proliferation of cell and metastasis, of course. So, but it is very notorious to target because it is a very difficult target. Yeah, but recently we are succeeding on MET inhibitor for example, MET exportin skipping driver. MET exportin skipping is a very good druggable mutant in non-small cell lung cancer, such as EGFR mutation or REF fusion or ROS1 fusion, ALK fusion. So ABN-401 is a highly selective and potent MET kinase inhibitor, very specifically targeting only c-MET. So at the in vitro study, ABN-401 showed a very effective inhibition of MET signaling by binding its intracellular catalytic domain, which is very similar to usual receptor kinase inhibitor. So I will show the result from the phase 1 study and phase 2 study. Actually, for safety data, I am presenting the data from the phase 1, 800 milligram of actually recommended phase 2 dosage, and phase 2 study for focused on MET exportin skipping. So for efficacy data, I will focus on 800 milligram of ABN-401 against both MET exportin skipping mutation. So it is just a phase 1 study, summary of the phase 1 study. Escalation study, actually 800 milligram dosage was administered in 3 patients. And extension phase, actually 8 patients, more 8 patients was enrolled during the extension study phase for 400 milligram QD. So we have some responder during the extension stage. So actually, among the 4 patients with MET exportin skipping, 2 patients showed a partial remission. Based on this promising, it's a background of the opening of the phase 2 study. So during the phase 2 study, we enrolled the patient non-small cell lung cancer with MET exportin skipping and by tissue DNA or RNA NGS and RNA ddPCR. And of course, all patients, no previous MET-driven treatment. So we administered 400 milligram of oral daily. So primary endpoint was objective response rate, of course. A secondary endpoint, the duration of response, disease control rate, progression-free survival, overall survival, and safety data. Then we just completed stage 1, 15 patients. Actually, we analyzed this data after enrollment of the 13 from the phase 2 study. So I am presenting the result of the ABN-401 efficacy and safety data. Some phase 1 study patient and 13 phase 2 study patient. So again, total patient is for safety analysis. 24. 24 is the patient treated with ABN-401 for 800 milligram, and then they have MET dysregulation. For example, MET exportin skipping, MET amplification, or MET overexpression. So for efficacy analysis, we just included MET exportin skipping patient, or 17 patients, and these patients are also treated with 800 milligram of ABN-401. So median age and sex and race. Race has enriched in Asian country because this study was performed in Korea, Taiwan, and USA. So some enriched Asian country. So and smoking history has 1/3 and 40% of the never smoker and 60% of the smoker patient. Then some treatment naive patient included. This treatment naive means the patient did not get any treatment for advanced stage non-small cell lung cancer, of course including a MET inhibitor. ABN-401 by site investigator, actually PR showed among the 17 patients, 58% of patients responded to ABN-401, 800 milligram, if a patient had best effortless skipping. Again, reminder, so we set this analysis for the patient with bad exoplantic skipping patient only, no other bad amplification or no overexpression. So if we focus on just previous treatment naive patient, so 75. Yeah, of course the number is not big. Yes, but 6 patients among 8 patients had treatment naive patient had responded to this ABN-401 400 milligram, and it shows a duration of response, and many patients are still ongoing the treatment. So, for example, the first patient, treatment naive patient, still ongoing treatment more than 1 year and 2 months. Yeah, so now actually follow-up duration is not quite long. So some patients are still ongoing the treatment with ABN-401 800 milligram. So again, treatment naive patient, objective response rate is 75%, and all best exoplantic skipping patient, of course, all bad exoplantic skipping mutation patient had not treated with MET inhibitor previously. So response rate was 53% of response rate. So again, we are showing the duration of response and depth of the response with a spider plot. It is again among the 17 patients, actually 9 patients responded more than 50%, and treatment naive patient among 8 patients, 3 patients responded to ABN-401, 75% of response rate. Again, it is a very representative image from the patient with exoplantic skipping. Actually, the patient was treatment naive, and he treated tumor regression, actually measured 72 millimeter to 49 millimeter. Actually, just in 3 weeks, 32% of tumor reduction. So from the ABN-401. So actually, finally, more than 40% of tumor reduction, and of course, a partial remission confirmed in this patient without any treatment-related adverse event. So actually, MET inhibition has a big issue of safety concern. So different from the EGFR, ARC, ROS1, actually MET inhibitor has a more unfavorable safety profile during the cametinib or tefotinib development. So we are focused on safety outcome in patients with 800 milligram regimen. Focused on each phase 2 study. So I will show the safety data from the phase 2 study, 13 patients, and again, 24 patients, phase 1 and phase 2 combined cohort. From the phase 2 cohort, nausea, diarrhea, rash was the most common treatment emergent adverse event in phase 2 during the phase 2 study. So usually most of the adverse event is categorized within grade 1 or 2, and just one patient had grade 3 skin rash from the ABN-401 800 milligram. And to see the large number of the data of the adverse event, we also showing the 24 patients from combined phase 1 and phase 2 or ABM401 800 milligram. So this table is a treatment-related adverse event, TRAE, in 800 milligram patient. Of course, the patient number is 24. And again, most common treatment-related adverse event was nausea, vomiting, and diarrhea. Yeah, but actually, all of this adverse event is grade 1 or 2. And one of most concern is the peripheral edema, actually from the CRESS effect. So peripheral edema was observed in just 20% grade 1 and 2, and there was no grade 3 or greater event in all safety evaluable population. So actually, it is some promising data based on the safety profile. Yeah, of course, our study is not quite too long to assess safety efficacy completely. Yeah, but it is a good signal for the safety profile for ABM401 800 milligram. Yeah, and actually again, treatment-related adverse event leading to permanent discontinuation of the drug occurred just 0% now. Yeah, of course, yeah, this data should be followed a longer time. So it is actually very comparative analysis of similar TKI, already approved Cametinib and Tepotinib. Yeah, so again, I should stress the number is quite lower than Cametinib and Tepotinib. Yeah, but actually, due to emergent adverse event and grade 3 or higher has 67% and 55% Cametinib and Tepotinib, and ABM401 800 milligram is 21%. And again, treatment-related adverse event, grade 3 or higher, compared to Cametinib and Tepotinib, 38% and 28%, just 8% of patients showed grade 3 or higher treatment-related adverse event. So it will be the a good signal for the safety profile of ABM401. The ABM401 has a promising anti-tumor efficacy and favorable toxicity in locally advanced and metastatic exposure skipping non-small cell lung cancer patient. And actually, 58% of response rate with exposure skipping mutation. So, and actually, if the treatment is done in treatment-naive setting, yeah, 75% response rate demonstrated. Yeah, of course, we always stress the small number of this study. So, and now, actually, median duration of treatment is just 5 months. It is actually shorter, and of course, longer follow is needed to confirm the favorable toxicity profile of ABM401. And 24 patients evaluated for safety of 800 milligram. Yes, no decontamination occurred due to grade 3 treatment-related adverse event. It should be, again, could be stressed. And no patient experienced grade 3 edema. Actually, a very tedious problem of the MET inhibition this population. So now, still ongoing phase 2 multicenter open-label trial is actively enrolling in U.S., South Korea, and Taiwan. So actually, I'm there to say, given its efficacy and safety performance, ABM401 exhibit significant potential in in the ultimate goal is MET inhibitor should be combined with other drug because acquired resistance. MET is a very important acquired resistance mechanism, including EGFR, ARC, ROS1, and MET. Yeah, actually, every category of the oncology addicted non-small cell lung cancer, MET is the common pathway of the resistance mechanism to tyrosine kinase inhibitor. So it will be a very important message from, although we have the small number of data.